Hello guys, good morning to everyone and shout out to all of you watching my channel now, Lorena Carion. And I would like to thank to all of you for having this time to me to introduce myself in all you are student or you are trainees or maybe you are planning to work in the hospital also. Whatever situation is, I just want to have a brief uh, techniques for my everyday everyday routine in my duty, situational. This is only just a continuation of my vlog about the extremities, but it's concerned also to the X-ray technician on duty. Anyway, guys, I read some of the students in the Radtech Career Advice, which is I joined the group and I read some of the problem students are trying to do their best, but they don't know how to take a good factoring or techniques in taking a good quality radiograph also. Of course, we are taking about the quality image of our what we call this x-rays. We are going to we have to be analyze about the thickness of the patient. For example, the problem is hand, very easy. It is only a thin part of the hand, and it is seems like you can use a 50 lower kbp, 50 kbp lower than that, 50, 49, 48. And then you try to see to it that it is good, like professional images when you check in the Google. You can use 50 kbp and use 5 mass at least, and it is very good result, I hope. Guys, thank you for always I just want to express my what I learned from my past experience since I was working here in the Middle East for almost 14 years, 13 years. Aside from that, I also work in the Philippines before I go abroad. So, I am lucky to have you and share this knowledge about my experience in working in the field of radiology department. And guys, I hope this kind of KBP, all of you students are asking for help, because I read the message and I react about it, because it's difficult to become first time in the field of radiology. You are working, most especially if you are alone. Now, all these challenges is just a part of our life as technician or student. If you are a student, you must try to Google it, or you must try at least to find it in the YouTube. You can maybe at least find some techniques like what I'm talking about right now. I hope you learn something from me about the position, about the techniques also, and different kind of maneuvers you're going to do in your situation. I don't know why I should say this, but I think we have to more on practice by learn by your mistake. It's okay, we are not perfect, we are only student, we are trainees, whatever, we are on the job training, we have already have salary, mashallah, but we have to at least do our best to have a good quality radiograph result. And that's, guys, what I'm telling you now. Now, if you have any questions about my brief summary now about the thickness or KBP, which is the kilovolt pitch, and the mass you're gonna use when you are making x-ray of hand only extremities. Look at the hand and the foot is almost similar thickness, so you can base on the thickness, not on what you learn from the book, because we are now working. So you have to apply all of this actually by your own knowledge, using your techniques and everything what you learn from the school. We are not learning in the school anymore. We are learning now our skill, applying in the field of our profession already. So guys, thank you so much for watching. I hope I learned you learned something from me. Of course, I know, I'm hoping and looking forward for you to more having more progress. And thank you for all of us here in Radtech Career, and I thank you so much for this day. See you there for another video. Bye.